Today's study on telemedicine looked at the different avenues we have to present quality health care to Oklahomans in remote areas of the state. We had several presenters from both private hospitals and state agencies discuss the way they're using telemedicine to treat people with cardiac illness compared to people in mental health and substance abuse treatment, the way that they're saving dollars from the doctors not having to travel out to a remote area and simply doing an interview over the internet. Also looked at the Department of Corrections, the way they're treating prisoners without having to take the prisoner out of the facility. So it maintains that safety for the individuals where the prisoner is not removed from the facility, but it also cuts down on that travel time for doctors and state employee to not have to go to a facility outside possibly the urban area where they currently work. The first telemedicine bill was passed back in 1997 by then Representative Jerry Askins, and we've seen great advancements since then, both in private and public partnerships, and using the fund that collects dollars to do matching grants to help. And I think all in all, it's a worthy investment for the state, and it's certainly helped people in remote areas and the rural areas of Oklahoma receive quality health care and get the treatment they need, and it helps cut down on the cost of health care overall. With that early treatment, it certainly reduces the potential for an illness to grow worse and grow costlier.
Just people in Oklahoma to be aware of the importance of telemedicine, especially as it relates to the rural communities throughout Oklahoma. It enables healthcare facilities throughout the state to keep more high-quality services local by having better access to specialists that traditionally they would not be able to have.
Child abuse investigation services have a support system through video conferencing across the state so that the professionals who serve the children who are victims of abuse have a high-quality system in place for support.
Telemedicine, the use of technology to access healthcare providers, health specialists, healthcare information, is integrating into our daily lives. The utilization of telemedicine in Oklahoma breaks down the access barriers for those not only in rural areas, but for isolated populations even within the urban areas. Those that are isolated to their homes, to cultural barriers of accessing care. Technology and the use of telemedicine for access to care and helping them become healthier citizens of Oklahoma is an important vision for this state.